Good morning, everybody. Good morning. We are now recording, so good morning to you and welcome to the Health and Care Overview and Scrutiny Committee, and it's the 2nd of December 2024. This will be our last meeting of this calendar year, and so if we can go straight to our agenda. This has been recorded live, so I welcome all of those that are online, and I will say as well that it will be available on the webcast for 12 months. So if we can go straight to apologies, please.
Good morning, Chairman. I've received apologies from Councillor Philip Atkins and Councillor Jessel.
And I've missed a call from Councillor Phil Hewitt, so I've not been able to take that. So if I can take his apologies, because I'm sure that's it, even if it's his apologies for being late. But I think we ought to record his apologies, being he has called me. So going on to the next item is the minutes. Sorry, declarations of interest. Thanks, Zach. Declarations of interest.
Good morning, everyone. Yes, Chairman, I'm Partner Governor on Midland Partnership Foundation Trust. Thank you.
Councillor Peters.
Good morning, Chair. I'm Partner Governor at UHDB.
Any others? And obviously, as the meeting goes through, that any something comes to mind, just let us know, and we will record accordingly. So, if I can go to the minutes of our previous meeting held on the 28th of October 2024. Councillor Norman.
Yes, please, Chair. I've spoken to Zach just a few minutes ago. It's just that quite a few members actually spoke on the district and borough reports, myself included, but Staffordshire Moorlands in particular, with issues of the minor injuries unit, and other members as well. None of that is in here, not even briefly, which I would expect it at least to be in there briefly. I also understand the problem insofar as it would be helpful if the officers at the district, including my own and borough councils, actually gave a slightly fuller report than this was the date of the last meeting, this is the date of the next meeting. I see Staffordshire do rather a bigger job of that, but quite a few members, I think 5 members actually from 4 members from different districts gave comments, and they're not in the minutes. I'm not asking them to be put in the minutes now because they are on YouTube, but perhaps in future, if there is a particular issue raised, you might consider that going in there, Chair. Thank you.
Yes, we could look at that. I had noted the absence of that, so I think it's a fair comment to make. So that will be corrected and going forward. I will sign those with your permission, and those thank you very much. So our first item, Wallace Quarry, Community Impact Study. I think before we start, obviously it's all known that the EA have served a close notice on the site, but obviously we'll carry on because there is a right of appeal, and the consequences are still under what we like to consider under the health impacts. Okay, so come forward. We have Dr. Richard Harling, and have we got Emma Sandbach? Not today. That's fine. And from Accardis, Alison Powell.
She's online.
Online.
I'm online. Hello.
Good morning, Alison. Thank you.
Hello. Can you hear me all right? All right.
And from the EA, Andrew Hitchings. I can see there. Good morning.
Yes,
Andrew.
I'm here, Chair. Good morning.
Good morning. And from the UKHSA, we've got Katie Spence.
Yep, good morning.
Good morning, Katie. And do we have Alec Dobney?
I'm afraid Alex off poorly today, so you've got me, Chair Toby Smith. So I work with Alec.
Okay, Toby, thank you.
Thank you.
So, with regards to the report, I take it members have read, and if we could perhaps, Richard Harling, if you could introduce. Thank you.
Thank you, Chair. So the situation at Wally's Quarry, I think the committee has discussed on several previous occasions, and I think is well rehearsed. We're specifically asking this morning that you look at the community impact study. So this was a study that was commissioned by the County Council on behalf of all local partners to explore the impact of the Wally's Quarry issues on the local community. There have been previous reports looking at health. The aim of this study was to include health, but also to go a bit broader and think about the impact of the emissions on the business and the economy, housing, the reputation of the area, community safety, and the well-being of that community in general. So colleagues from Arcadis are on the report for any methodological and points of detail about the report. There are 7 recommendations which are under Paras 16 of the covering report, or I believe page 110 of the full report. It will be for local agencies now to consider those recommendations and the response, and we'd be happy to provide a further update once we've done that, Chair. Thank you.
No? Do you want to?
Thank you, Chair. I've got nothing further to add. Apart from just one comment, which is Richard's alluded to the fact that the committee has seen the impacts from Wally's Quarry a number of times. And I think it is because of this prolonged nature that this report is really important, and I certainly endorse the recommendations from the report.
Thank you, Councillor Pert. Open to questions. Unless, do we want any preamble from any of our guests? No? No, that's fine. Councillor Edger.
Thank you, Chairman. Yes, I just want to comment and just say that I think this committee did everything they could, even having the meeting up in Newcastle, you know, about Wally's Quarry. And we asked for it to be closed, but there again, you know, and the EA wouldn't attend the meeting. So I've got to say this committee did everything they possibly could, you know, to eliminate the problems that they were having up there.
Okay, thank you. Councillor Norman.
Just 2 questions. One from my colleague who was here, and due to some miscommunication, though, I still think I'm right, that I should have been here today because she was not supposed to be here yet. But anyway, Councillor Onilong did want me to ask about, to point out the number of breaches that have taken place. And the question I could add to that is, just how many breaches does it take to get a quarry closed? I mean, you know, how many times do you say, OK, I'll try better next week or next month or whatever? That's the first question. And the second one is just to point out on the 29th of July when I was here, I did ask the Environment Agency if they needed any more powers, and there wasn't a straight answer given. I understand it was a political, small p, political difficult question. But nevertheless, presumably the answer was they didn't need any more powers, but just didn't get round to doing this. But, you know, the health impacts, we've got health impacts, but what about the follow-up as well afterwards? You know, if there are health impacts, then there needs to be some follow-up to this afterwards, and maybe there to be some people responsible for the lack of action that's been taken over the last number of years. Thank you, Chair.
I think in answering about the powers, I think if I'm right in speaking, and Zach will correct me if I'm wrong, as the Scrutiny Authority, we don't actually have the powers to...
no, just because you misunderstand me, Chair. No, I'm just asking the Environment Agency if they need any powers from the government. No, I know we're doing our job. You're doing your job. It was...
Thank you for that clarification. So that saved me my embarrassment. So, question then to the Environment Agency, obviously, in terms of that. we've got Andrew Hitchings.
Thanks, Chair. Can you hear me okay?
Yeah.
Yeah. So we certainly understand in the Environment Agency that the community and this committee would have liked to see the outcome of a closure notice come sooner. But our actions have always got to be in line with the regulatory framework and the regulatory code. A closure notice is not a decision to take lightly. It can only be used when all other regulatory options have been exhausted. It can, and you know, as this committee probably knows from previous representations from the Environment Agency, the Environment Agency's preferred outcome would have been for the operator to have got the odour and hydrogen sulphide under control in a sustainable and sustained way. You know, a lot of effort was put into that by the Environment Agency through enforcement notices, suspension notices, over 180 regulatory interventions. We have come to the point where we've concluded that that is not going to be successful. So the only way to achieve the outcome is for us to issue a closure notice. And that has come because we now believe that the site operation is poor and continued operation will result in significant long-term pollution. That answers the question in terms of why we've got to a closure notice at the time we've got to it. Were there other questions that you wanted me to pick up?
Do you have a follow-up, Councillor Norman?
Well, only that it didn't help not having faulty readings off the instruments for so many years as well, which is not the Environment Agency's particularly fault. But, you know, if you're going to go with evidence to take action, you need to know that you're sure about the facts you've got. And if you've got faulty instruments, as the case, the calibrations, and that, as I recall, that doesn't help. But, okay, well, we are now where we could have been some time ago, I would have thought. I do have sympathy with the Environment Agency. I know that as a council, you always try and help working with people who are doing things wrong as far as the public is concerned, but you realise there are difficulties in that. But as someone who's been all the way to Germany just to check on animal rendering plants, and I've been a vegetarian since I was 14, just to find out how it could be done, that was the only way I could get the action taken in my own borough previously of getting some action being taken with the evidence of what could be done. And I'm not sure that perhaps the pressure was put on this quarry saying, look, you could be doing this, you're not doing it, you've got a few weeks or a few months to get it sorted. But hey-ho.
I think the point, Andrew, that Councillor Norman is making is that we've been here so many times and we've heard that the machines are coming from the States, they're delayed from the States, then when the machines arrive, they're not calibrated properly, etc. So there seems to be a delay. But we welcome, I think, as I said, we do welcome this decision now. And it's a question of really what happens next. But before I say anything more, if I could bring in Councillor John Jones.
Oh, thank you, Chair. On the same sort of theme as Councillor Norman, I think. I agree with what's here. I think it's good. But I mean, people are living with this day in, day out now, and have been for a long time. I'd really like to see some indication of timescale on this. When are these things going to be done? Because at least to give them some hope, because it must be an absolute nightmare. The house prices are affected, their health's affected, and I think that would be my only. I think the recommendations are good. I endorse them all, particularly with recommendation 6. A transparent and comprehensive approach to plans for its restoration is good, but by when? I think that's what I would want to see. Thank you, Chair.
Will you be able to answer in terms of when? I mean, is that something that you would be looking at in terms of public health?
So I think in terms of the recommendations, following the conversation today, the next step is for local agencies to consider those and respond to them. So if the committee are able to endorse all of them or give a priority to specific ones, that's a steer for local agencies in terms of which ones are the priorities for local residents and the population. The recommendations, I suspect, will all have different timescales. So some of them will be more immediate. Some of them, like the recommendation about following up long-term health, will be, that I presume will be a long-term endeavour were we to do that. But I guess the request from agencies will be that if we accept recommendations, we are then clearer about owners and timescales and action plans and that sort of thing.
Right, Chair. Yeah, I agree. I understand that, but at least could we have some indicative time? I mean, before I was a paramedic, I was a project manager, and you could say that will happen by then. We're aiming to get that happening by then, and we're aiming to have that by then. Can we not at least do that to give the people that live there some hope, something to aim for, and at least if the deadlines get missed, then there will be some at least some discussion as to why. I think we should be aiming. We must know how long these things have taken on previous issues like this, and at least give some indication. I'm not saying put a date in the diary, but at least say by the end of next year we will be at this particular point. Hopefully sorted, but I mean it may not be. Thank you, Chair.
I don't know whether are we able to do that. I mean, I'm probably thinking, well, we should. It's a question of whether it's feasible. I think I know where Councillor Jones is coming from.
At least let's put it in as an ambition, Chair.
Yeah, and we certainly can. We're just not quite there yet, I don't think. So the next stage is whether or not we accept the recommendations, A. Then if we do, we get into questions of which agency specifically leads on which recommendation, what are the timescales, what's the governance of that, all of those kinds of things.
Yeah, I think what we can accept, if we are in accepting the recommendations, those recommendations then from the committee then have to be assessed and so forth, and then obviously we can then timetable it. But I think that will be noted for sure, because I think we all want to see that to come to a conclusion. There obviously is a period where the management team of Wallace Quarry, I do believe, have a right of appeal. Now that will not be immediately, but we're here for the impact on health, which obviously is a question that Councillor Norman raised, which is in line with what you are saying as well, because we have to draw the to a conclusion. But I think this is I'm afraid to say, I think it might be still a running theme for us to just not switch off, and we are very much firmly on the case to ensure that the impact of health and so forth from Wallace Quarry, even from the fact that if they're succeeded in the closure, how we get through. So I think before I bring in Councillor Janice Sylvester-Hall, I think this is a question that may be for Andrew, and then perhaps Katie can add to it, because obviously there are continuing issues. And I might actually think, can Katie come in first because of the what your views are in terms of the ongoing, because the smells are not going to go away just because the site is closed. So, Katie, could I bring in your views on where your perspective, please?
Yeah, absolutely. And yes, I mean, I think we're all aware that the closure notice, although we absolutely welcome that is not a situation that means that we are going to see all odour being then prevented. I think that is a really important point that you've made, and therefore clearly we are now going to potentially be going through a process of understanding what this next stage looks like and what the consequences and implications will be, both for odour and then subsequently impact on local population. And clearly we're interested in that from a health perspective. So I think you are right. I think this is something that we need to very closely understand what the next steps could look like. We clearly would expect the monitoring to continue and that information to be continued to be shared with us on an ongoing basis, so we can continue to therefore monitor the potential impacts. And I think that will be something we would envisage should be in place for the foreseeable future. So it is a potentially it's a positive next step, but it is certainly not a next step that then suggests that we are in a resolved position from a health point of view.
Before I come to Andrew on that, I suppose, Councillor Norman, you indicated to just speak, so I thought it was on that theme.
I'm just going to talk to the recommendations. That's just, so I'm sorry, I'm just put my hand up for getting in the queue. That was all, Chair.
Okay, I've got you. Andrew, would you like to come on to...
Yes, I'm happy to come in. So the closure notice is the first step towards permanently closure of the site. That is a process that will take some time. The important things that the closure notice does is that from last Friday, no further waste could be accepted on site. The closure notice requires capping of operational areas of the site, and it requires the installation of gas infrastructure to extract landfill gas from operational areas of the site. Those measures, once completed, will have an impact of reducing the fugitive emissions of landfill gas and therefore reducing the odour and the other impacts. The timescales are in the notice, so gas infrastructure has to go in by the 24th of December and operational areas need to be capped by the 31st of January. That notice is available for the public to view on our Engagement HQ website. So that's what the notice contains. Now, it was mentioned that there is a right of appeal. Wally's Quarry may or may not take that right of appeal. How that proceeds into the future, I can't comment or speculate on, but that's what the notice requires. I think the only other thing I would say is that permanent closure and restoration of the landfill will take a long time. If you look at the existing permitting arrangements, waste was allowed to be accepted until the end of 2026 and restoration materials to the end of 2042. So, the closure notice is the first stage. It's necessary based around what the Environment Agency has concluded, but the landfill will be there and will need Wally's Quarry to continue managing it under the permit for some considerable time.
Thank you, Andrew. I think that's, to me, is clear. But I think the brief from this committee is that, without being rude, we are watching, because it is clear that there is an impact on our residents. So we'll be keen to obviously see those actions that you refer to being done as quickly as possible to lessen the issue on that. Councillor Janice Sylvester-Hall.
Thank you, Chair. Good morning, everyone. Yeah, I have another question now, actually, following that particular piece. I thought this was an extremely comprehensive report and fascinating to go through and to look at all the detail where we can move from being anecdotal. I remember the first time, which goes back a couple of years now, that I drove up to this particular area and took time before meeting to go into the communities, to look at the monitoring sites, and to notice, even on the pleasant day that it was, that there was nobody walking dogs that I could see, that there was nobody on play, sort of green open spaces that I could see, and the smell that was in the air on that particular day. So seeing the tens of thousands of complaints in this particular part, the COPD reports in particular, it's that anxiety level that stood out to me for those people living in all of the houses in very close proximity. Seeing the stats on school sickness and the context given to that, my question really at this point, following all of that, extremely useful and pertinent information, is on the communication side. And I think that's even more so important from what we've just heard from the EA as well. When it comes down to the recommendation about communication, is there some clarity that we can just have about how that's going to be effectively coordinated? Because I think that is going to be so important. And knowing that we're covering a number of different partners that are involved in the process, is there one clear owner, maybe, for coordinating that? because I think even more so now, which I may, if I may, Chair, put on the second part of the question, is back to the EA, is that this is also now a very critical time in making sure those milestones are delivered that we've just heard. And what happens if they're not? So that's my question to the EA, but if I can also ask the question about how we make sure that this stage now is clearly communicated, because I think that is ever so important. Thank you.
Richard, would you like to come in on that? And then I'll invite Andrew to answer afterwards.
Yeah, so there's a recommendation one about the continued community voice. I think that's a discussion between local agencies about the most appropriate owner. It might, for example, be Newcastle-under-Lyme Borough Council because they're the closest to it. But I think we'd want to agree that between ourselves and make sure, as you say, that it's properly coordinated and that there's a single point of contact for people.
Andrew, would you like to come in and answer the question from Councillor Sylvester Hall?
Yes, happy to. So the first stage of the closure notice required Wally's Quarry to stop accepting waste on Friday. We attended site on Friday and they had stopped accepting waste. The closure notice requires Wally's Quarry to comply with the measures within it. That is what we anticipate will happen. Beyond that process, and given the appeal and the uncertainty about that, I don't think it's appropriate to comment any further.
Councillor Sylvester Hall.
Yeah, I think one of the things, I appreciate the context in which the reply was meant, but I think it also just pays to serve to reiterate your comment about keeping a close-in watch. We know the levels of permit breaches, even though we've had the level of scrutiny as it stands at the moment. So I think it's worthwhile just making sure that those plans are also there in case. Thank you.
Thank you very much. Councillor Kath Perry.
Thank you, Chairman. Thank you. And good morning, members. It's not so much a question. This has been going on for a number of years now, as we've established, and it's taken years to reach this point. The recommendations that are in this report will take a long time to develop, and it's concerning that the community and the residents will still have to live with this issue for a while longer. I am concerned about that because it's been going on for long enough. How long does it take to get something sorted when there's so many of the community actually raising their points? I agree with the recommendations that are on this report, but disappointed that it'll still take a while to reach the point where we do something about it. And I hope that the conclusion can be drawn as soon as possible. There's not probably a question, but it's been going on for so long. We've had this in front of us for so long. How long does it take these things to actually, you know, as a public and resident myself, I don't live in that part of the world, but I understand their concerns. And yes, it's taken this while to reach this, but there's still no conclusion as yet for a while longer. And it's just so concerning for me. So if you can find a question in there, I'd appreciate a response, but I'm sure you won't find a question in there. But I just wanted to get my points over. Thank you.
I think we can all agree with you, Councillor Perry. And I actually possibly think in lines, this is the same question that has come from Councillor Jones, is timescales. Obviously what we've got an issue here is that this report and the recommendation is for this authority and obviously to take on going forward in terms of those health impacts. But I think it clearly goes back to the EA on this without pointing a finger, Andrew. But I think you're getting the message that we're getting a little bit rattled in the sense of the length of time that this whole thing has taken for whatever reason is being given. So, Andrew, you've given us some timelines, but what guarantees, if you were able to, without the exception of an appeal, what guarantees can you give at this committee that we are getting on with the job?
Thanks, Chair, and obviously I know a sentiment that the committee's kind of expressing. In terms of returning to my previous answer, the closure notice sets clear timelines for actions that will improve the situation for the community through the installation of the gas infrastructure, the capping, and the stopping of accepting fresh waste that I previously described. The Environment Agency has put a huge amount of regulatory effort into Wally's Quarry over the past years. We will continue to do that, and I think the important thing is to recognise the commitment that we have to resolving the situation for the benefit of the residents. Beyond that, Chair, I can only come back to what I said earlier. I can't really speculate on things that the Environment Agency may or may not do based upon what Wally's Quarry may or may not do.
I think that's the crux, and but obviously I think the onus is still to be absolutely doing what you can in the interim period of whether an appeal is lodged or not. It's making sure that those actions are taken in a swift manner. Can I bring in Councillor Bernard Peters? And I've got three other speakers to go, so obviously let's try and come up with some new questions.
Thank you, Chair. As you say, let's try and introduce another dimension to this conversation. And I've picked up in the early stages of the report comments regarding stress and anxiety for residents and people feeling stuck and imprisoned, all of those things, and with an impact perhaps on mental health. And now mental health is always a default position that people refer to. But what I've been doing is coupling all of this to everything else that's going on in the community at the moment. For example, issues related to the cost of living. So people are trying to manage and deal with that. And the people in this area are significantly aggravated by the stories we've heard today. So do we think that the impact will get wider, not only as a result of this incident, but all the other stress and anxiety related issues that are coupled with it, I think, which the public will be experiencing? Thank you.
I think that's the more of a comment, if I'm right. There was in it there wasn't a direct question.
The Director for Public Health would think that there could be some fallout, pardon that pun, from that issue and an impact on other people because of everything else that people are having to put up with at the moment.
Thank you, Councillor Peters. Richard Harling.
Yeah, so I think it is important context. Need to remember that Wally's Quarry, this situation isn't happening in isolation. And I think one of the points that's been brought out in this study and in previous reports, actually, is that this area of Newcastle under Lyme is relatively deprived and the underlying health is relatively poor. And therefore this is an additional factor that contributes to even worse health. So it's just some important context to remember. I think it becomes relevant if we're following up health in some sort of way. Yeah, and something to keep in mind.
Thank you very much, Dr. Harling. Councillor Norman.
Thank you, Chair. I'm just on the recommendations. I support all the recommendations. It's been difficult not to do all of the recommendations, but the ones that are of particular interest and of concern for this committee, I think, is our recommendations 2 and 3, which are the health impacts and the following up of the health impacts and looking at the data going forward. When I was opposing opencast many years ago, I used all the arguments I could, except the one that said there was a correlation between opencast mining and the dust and causing health problems, which I couldn't use because I knew there was no evidence for it. And the problem that you always have is that people assume certain things. So the communications, the recommendations, and all the other recommendations, which are talking about communication, that's where it's very difficult. But that's where it's essential to try and get the public trust in that. More difficult these days with Twitter and Mr. Musk and various other things. But that's the difficult one to actually take on, and trying to get trust in people having trust in the data and the evidence and so on. So I don't envy all those different bodies that are beginning to have to do that, working together. But certainly, say for this committee, 2 and 3, if there's a priority, then 2 and 3 I would suggest, Chair, and looking forward to seeing further reports in the future on that, especially with the idea of, milestones and things like that. So, thank you, Chair.
Thank you, Councillor Norman. Alison, bringing you in onto the debate, is there anything you want to add to what Councillor Norman has just phrased on those recommendations 2 and 3?
Oh, thank you, Chair. I suppose from our perspective, from having undertaken the study over the last few months, and the biggest thing that I think has stood out for us in terms of putting the study together, and obviously we've been drawing together evidence from a variety of sources, so from literature reviews, from publicly available data, but really importantly from that community engagement side of things, and bringing those together, the importance of that of communication and ongoing transparency and openness over the next steps. I appreciate when we wrote this report, obviously the closure wasn't hadn't been announced at that stage, so we're writing this with a understanding of what the next steps might be. They could have been a continuation as it was, or is now the case, the move towards the closure, which obviously would be welcomed by the community hugely. So it's about that transparency and open approach over the next step, so that people know what is happening, and appreciating everything that Andrew Hitchings has been talking about in terms of the variety of issues that may what may or may not happen in terms of Wally's Quarry and so on, but in terms of timescales and being able to communicate that in an open and transparent way to the community as a whole is really important. And I think the importance of helping the community be able to, obviously our report is a bit of a snapshot in time in terms of some of those short-term health issues that have occurred and that people have reported to us, or there's the self-reporting that has taken place. But that stress and anxiety and the long-term mental health condition of the community, and the potential impacts that might have in terms of physical health impacts, and the long-term impact of stress and anxiety is a really important one to consider. And I think in terms of being able, as a recommendation, being able to proactively put something in place that it shows action to the community. It shows that the community are being listened to. We've talked already. It's been highlighted already about the difficulty of correlating impacts because of the various other factors that are at play. Obviously, we're coming out of the COVID pandemic at the time that the incident really started taking place. We've gone into a cost of living crisis. We've got the issues with deprivation, as Dr. Harling has mentioned already. So there are various other factors which conflate the evidence. But I think if we could show, if a longitudinal study could be developed over a time period to be agreed and discussed amongst partners, I think it could show, and we could compare that potentially to other control areas to see if there's a particular issue, and to monitor the health of the community in this area. I think would be a really important message to send to local residents of taking some of these health impacts seriously, and particularly those concerns around long-term mental health impacts and the concerns with stress and anxiety. So I do see that as being a difficult recommendation, but an important one as well to try and nail down. But I think that communication and building trust with the community I see as being really fundamental to everything, if I'm really honest.
Sorry. Thank you very much, Alison, and I think that is quite helpful in understanding where the recommendations. Now, whilst Alison was speaking, obviously there's a couple of more speakers there that have indicated to speak, probably on something that she may have said, I don't know. But if I can just call Jill Hood in, and then I've got Phil Hewitt, and then I've got Councillor John Jones and Councillor Anne Edgley. I think after then, I'd like to obviously go to the recommendations to say whether we accept them or not as a whole. So, Councillor Jill Hood.
Thank you, Chairman. I remember going to the meeting a couple of years ago now when the Environment Agency didn't even bother to turn up, so it's quite good to have a representative here today. It concerns me that we speak about the area as a deprived area. Yes, we all know that, but I don't think that's helpful to the residents there to know that they have that label. We should be feeling slightly jubilant, but I don't think we should, because we're now going to enter into a period of expectation by residents that things are going to be okay, when in fact we know that they're not. I mean, that either the removal of the gases, they must be on a knife edge, every resident, every day, thinking that maybe they have a cough or a headache. Every symptom they will be imagining, and maybe it won't be imagination, it will be a reality that something's coming from that dreadful site to actually affect the health. But what really worries me, and I would like to ask this question of Richard Harling, the expectation of the residents. I know I have many residents who contact me to say that they just can't get an appointment with the mental health agencies, which is extremely worrying, because it must be quite a common factor with the residents there, both adults for their children, every member of that community. How on earth are we going to manage the increased demand on our mental health services for these people over the next few years that we desperately try to sort out this massive problem that we've got with Wally's Quarry? Thank you, Chairman.
Richard Harling?
Yes, I think we want to talk to the NHS about making sure that mental health support is available. The NHS did set up a dedicated clinic for a period of time. It wasn't as heavily used as we might have expected, actually. So I think that was discontinued. So the first point of call now is as it is for everybody else, through people's GPs. We will certainly talk to the NHS about keeping an eye on those pathways to make sure that there is sufficient capacity and to make sure that we aren't building up huge backlogs and waiting lists, particularly in that area, over and above the waiting lists that obviously exist elsewhere.
Thank you. Are you okay with that? Yep. Thank you, Jill. Chairman of Council, Phil Hewitt.
Thank you. Firstly, my apologies for being late. I did have another meeting which I had to attend, so that was the reason, Mr. Chairman. We can, I can relate to this, and I'm not going to labour a point, because I live in an estate with a landfill site sits right next to it, and a number of years ago we had massive toxic issues, or massive smell issues, which affected our everyday life. So I think I'm one person, well, two people in the room that can genuinely relate to what a daily challenge this is. Fortunately, we had a company that genuinely worked with us, and we worked very hard, and it was capped and gassed, and to be fair, at this stage we have little or no issues with this, so that's great. So I can relate to how it affects the daily life, and I can only endorse what Councillor Hood said about the people that live there and the challenges that they have in normal life as well as this. So I think the recommendations are good. I agree. I read them, and I think this is a good report. It's a comprehensive report. There's a couple of points. I don't think it takes that long to cap it off. I think I get concerned that Wally's Quarry will try and kick this into the long grass, because primarily that's their track record. So to cap it off, in Cannock we did that. in months rather than years. I'm also aware that it costs hundreds of thousands of pounds. So it's quite a big investment to do that, but it's nothing compared to the help of these people who live next to this quarry. It is absolutely insignificant compared to the help. So I think that should be done at speed. That's a comment, not a question. I think that's my opinion. I think the running the gas pipes is a bigger challenge. I learned an awful lot by visiting the site in Cannock. But my simple question, once I've made that statement, and I really wanted to make that statement that this needs to be done, it needs to be kept up at speed. My simple question is, we need to revisit this on a really regular basis, Mr. Chairman. We need to come back. We need the environmental agents to come back. We need the cabinet member, etc., to come back and really talk about this on a very regular basis. Because I feel at some stage that the Newcastle Council have been a great, as far as I can see, the people I know there have been a good voice for the community. But we have a voice, we have a strong voice, and we need to use that voice. I can think of nothing locally that's bigger than this, to be fair. So I really wanted to come back, and let's in simple terms, let's hold people's feet to the fire on this one, because we've got the first one, we've got it closed, Mr. Chairman. After that, it's absolutely clear that it needs to be capped, it needs to be piped, and it needs to be. I don't know it takes years to do it, but it needs to be made safe in every way possible, that these people can live the rest of their lives safely and happily. Thank you, Mr. Chairman. So my singular question, in an awful lot of words, was, can we bring it back on a regular basis?
The answer to that will be yes. I think we will, as soon as we have tangible information, we will try and fit that in where and when possible, because I think you're absolutely right. We can't let this disappear. There's still a lot to run with it. Trying to be brief now, because Councillor Jones. Oh, Councillor Pert, just on that.
Thank you, Chair. And obviously the recommendation for ongoing monitoring that was mentioned earlier by the UK HSA is a way of monitoring some of the gas that's coming out. But I'm also mindful that there are potentially two conclusions from the closure notice were Wallis Quarry to appeal. And it may be worthwhile sending this report and the summary to the Secretary of State just to maintain the pressure that clearly communities are feeling. And I certainly agree with the Chairman of the County Council's comments about Newcastle Borough Council steadfastly standing up for its residents, because they've been a significant voice in the whole of this debate.
Thank you, Councillor Pert. I had got a note that I think, in rounding up, that was going to be one of my suggestions, that we do send it to the Secretary of State. So if we can be brief, Councillor Jones, and then of course I've got Councillor Edgley, and then I will close this particular agenda to a close.
Thank you, Chair. I will be very quick. I just wanted to endorse the comments by the County Council Chairman, particularly his one about doing stuff at speed. And just to come back to my earlier point about timescales, I think we can't underestimate the importance of that to the mental health of people. You know yourself, if you sat in the A&E queue and you don't know how long you're going to be waiting, that's really depressing. But if you can see a little list clicking down and you know that you're 5th, 4th, 3rd, 2nd, 1st, you've got something to aim at, then that's a lot better. And I think we need to give I mentioned the word hope earlier, and I think we do need to give people hope that it will be done by a certain time. You know, I think the word prisoner was used once or twice in the survey that was done. But even prisoners have a release date to look forward to. And I think we need to give these people that sort of hope, Chair. Thank you.
Thank you, Councillor Jones. I think the sentiments are shared by members. Councillor Edgley, and then I'll come to the recommendations.
Thank you very much, Chairman. Yes, it's really good listening to everybody's comments and that, but my question here really is about the children in that area, you know, and what evidence do we have of the amount of education they're losing because of their mental health, physical health, and all, you know, the impact that it is having on the children in that area. So do we have any evidence of the amount of education that these children are losing because of the impacts of Wallis Quarry?
Dr. Harley?
So we do have some. It's a little bit anecdotal at the moment, which is why the report includes recommendation 5 for a more thorough analysis of the impact on young people, particularly their school attendance, their school results, that sort of thing.
Thank you very much. So I think if we round up, I think we've had a good debate there. Not to dwell on time, because I think it's very important that we discuss this, and I think contributions have been superb. So we've obviously, from the report, which I do commend as being absolutely a good report, and one that I think we certainly should share with the Secretary of State. So if members are happy with that, we'll take that forward. I'm getting plenty of nods, so we'll organise that. And then obviously within, as a report as a whole, in doing that, we are comfortable with the recommendations and the report, that we are accepting what's been said. Members, are you happy with the report? Yeah, so plenty of nods and hands up. And so finally, may I thank Alison for your contribution, and obviously behind the report. Greatly appreciated, and has been received and welcomed. So we thank you for that. And Katie, I guess your work doesn't stop. You will continue to monitor this, and obviously we as a committee would be very interested with any updates that possibly we should be aware of, because there is a will from the members that we don't let this one disappear into the wilderness. It's very much firmly on our agenda, and we'll have to look and see how that fits in. So Katie, no doubt you'll do that for us, and thank you very much for your contribution. And finally, Andrew, whether we can see you there. Andrew, again, thank you very much for your participating and answering. I think you've got the task of expediting this situation as PDQ, pretty damn quick, I think is the expression, because obviously there's still lots of open areas where people are still going to concern. And I think the key thing is, it is managing those expectations of the residents. But my word, those residents have got a good case, and so I hope that you will carry out what you said you will do with great expediency. But thank you very much for your attendance.
Thank you, Chair.
Okay, thank you all. So if we can move on, and thank you, Dr. Richard Harling. I appreciate your contribution. So moving on to item 5, integrated care hubs, a report from the MPFT, and we've got Adam McKeown. Yeah.
Morning, Chair.
Good morning. Would you like to give us present your report? Say 10 minutes, not too much longer on that, but nevertheless, I'm sure you'll get it all in.
That's great. Thank you, Chair, and good morning, everybody. Firstly, my apologies for not being with you in person today. It's only exceptional personal circumstances which has stopped me from being there. But hopefully you can hear me, and the report will be clear. I'm going to take the report as read, but what I propose to do is just pull out just very briefly a summary from the paper. This is essentially a position statement from Midlands Partnership NHS Trust, and it's regarding our integrated care hub development scheme. I'm sure many people will be aware of this, but just so that we're all exactly on the same page, MPFT have essentially acted as an agent of the Integrated Care Board for Staffordshire and Stoke-on-Trent in the development of the integrated care hub schemes, which initially, following a strategic outline case, which you can see in the paper, was a fairly straightforward task. The idea was for us to develop both a clinical model and a series of business cases. MPFT stepped forward in the system as we've got a large capital reserve as an organisation. following the COVID pandemic, what was a relatively straightforward piece of work, essentially designing buildings and the clinical and operating model, became much more difficult. You'll see from the paper that as an organisation, we made the decision to develop the business cases in 2 stages, Leek and Longton being the first stage of that. And subsequently, the capital regime that the NHS is subject to has become significantly more restrictive. In essence, I think what the position statement is outlining is that whilst we do have capital as an organisation, a significant amount of capital, we no longer have the local freedom to spend that capital. So we're in the position, and the paper doesn't quite go into this, but we have undertaken lobbying of both local MPs. There's been communications with the Secretary of State and the former Secretary of State, and essentially we've got to the point where although business cases, certainly outline business cases, have been developed for the integrated care hubs, there is currently no appetite to sign those off from the NHS England process, which is a national one. So we're in the position that we didn't want to be in, which is that we have business cases, we have an operating model, we've undertaken a number of public engagement exercises, but at this stage, we do not have permission to move forward to a full business case process and to spend any of the money. You'll see the latter part of the position statement essentially just makes the point that as an organisation, we've tried to be as pragmatic as we possibly can with the current sites that we do have, and we've outlined, at the request of Councillor Pert, we've outlined the services that we have currently brought onto site, particularly with reference to the Leek Community Hospital, some of the clinics that we run there, some of the community services that we have returned to that particular site. But at this stage, unfortunately, it's not a good message that I've got to land, which is essentially that we're at a stalemate in that we can't move forward with the build. We are currently doing everything we can to utilise a state which is not entirely fit for purpose, and we await decisions in terms of NHS finances for 25-26, and then a longer term financial settlement, which I believe is going to be predicated on the NHS 10-year plan, to give us any hope really of securing any funding into the future. So hopefully that just gives you a very quick idea of where we are. Obviously happy to take any questions and feedback.
Thank you, Adam, for that. Councillor Charlotte Atkins.
Thank you, Chairman. Why can't the integrated care hubs proceed without major building works? You know, the integrated care hubs were supposedly offering 40+ services, including, and I think this is an important issue, mental health services. So why can't that be done? You've listed in terms of Leek, which is where I represent, a whole range of services. So why can't that be expanded to the 40+ services at the existing hospital?
Adam, over to you with that.
Yeah, so I think what the paper sets out is the services that we've returned to the site. I think that, you know, there's always there's a limit to what buildings, particularly older buildings, can cope with in terms of efficiency of numbers of clinics, for instance, being delivered within the particular space, and obviously wanting to not have huge amounts of space that's wasted. But I think the original capital case was built on the premise that our current infrastructure, both at Leek and at Longton, was not fit for purpose and needed to be replaced. So yes, whilst there's opportunity to use those buildings and to return as many services as possible, I don't think that we can say categorically that every single one of those services described in the original integrated care hubs can be provided at the site without any capital works.
One of the services you list is the minor injuries unit. Now, clearly, there's proposals going forward from the ICB about closing the MIU. Is that a decision for the ICB, or is that a decision for the Midlands Partnership?
Yeah, thank you. So it's a consultation, as you said, that's being run by the ICB. Absolutely a decision for the Integrated Care Board as the commissioners of that particular service.
So, as a partner, as an ICB partner, your organisation sits on the board. You have no influence over that.
So, yes, of course, we have influence as a partner member, as one member. But as you'll be aware, Councillor Atkins, the MIU consultation is based on moving to taking account of the national model of urgent treatment centres. So I'm not. I don't have the latest information in relation to where that consultation is. I can certainly take that back as a partner member. But yeah, I wouldn't want to give detail that I don't have, essentially.
But I'm assuming that as a Midlands Partnership, you regard the MIU as being a vital service for an area of 222 square miles, i.e. the Moorlands, and that you would not want to lose that service. And have you discussed this with the primary care network? Because I believe that there have been discussions with GPs about the future of the MIU. What do you know about that?
Sure. So in relation to having access to urgent treatment, absolutely. That's something that we absolutely recognise. I don't know personally about the discussions that have taken place in relation to the MIU, in relation to primary care networks, but I can certainly find that information out.
If you could, because it seems to me that at the moment there's an issue of passing the buck. You're saying it's an ICB decision. They're presumably saying it's a Midlands Partnership decision. And in fact, the Midlands Partnership has issued a statement to the local MP, to the effect that the MIU will not close. So, I think we need to get that clarified. There has to be transparency in this.
Sure. I'm obviously here not to talk about the MIU, but I absolutely take your points on board, and I can certainly feed that back.
Councillor Atkins, you're quite within your right in terms of the concerns of Staffordshire Moorlands and in particular, obviously, the League Hospital. I have had conversations with Tracy Shewan of the ICB, and I know, and of course, I'm continually being told there are no proposals. Now, obviously, we've got to draw that out, and that's why I've given, obviously, as much to this as possible, because I do wish to obviously draw that out. But obviously, if one person is telling me no proposals, I'm not too sure where to go. But
Chairman, why then do we have two consultation meetings in Leek? One at the Maud Institute and another at the Haregate Community Centre, and both talking about proposals, if no proposals exist. What were those meetings for? A complete waste of time?
Please, I absolutely share your concerns, and obviously I will take back your concerns, and obviously from the meeting it was recorded, and we'll try and get those out, because there must be obviously something from what you're telling me. There is something going on here, and we need to get that bottomed out, and I think you have every right to raise it.
We talked about Wally's Quarry and transparency. I think here there's a complete lack of transparency, and we're being lied to.
And I will take those comments on. I'm going to call in Councillor Jones, and then I'll call in Councillor Bernard Peters. Because no doubt Councillor Jones has got something else to say on this matter, which again I respect, but obviously in terms of the meeting in question is with Adam and the integrated care hubs. So we're aware of those issues that you've raised, and I have listened to you both, by the way, on your district council webcast, so I knew exactly that we were going to obviously have this, and it's just fitting it in, how we can draw it out without losing obviously what we've got about in terms of the integrated care hubs. So, Councillor Jones.
Thank you, Chair. I will be brief. I just wanted to add my support to what Councillor Atkins has just said. It's all smoke and mirrors at the moment. I sat in one of those meetings, those consultation meetings at League. Councillor Atkins went to both of them, and it was clearly put up on a slide that these were proposals. And they're only proposals, they're not firm plans, but they're proposals. And then for the MP and you to be told subsequently that there are no proposals, there are proposals. Either there is or there isn't. Chair, I think we should ask for a definitive statement on this to this panel to clear the air, really, because transparency there is none, confusion there is lots. Thank you.
Councillor Jones, absolutely, and I will take that on. I've just a quick word with Zach here. We will, if the committee is minded, that I will write to the ICB to try and draw this conclusion, because information has been obtained that obviously needs bottoming out, whether it's true or not, and I think because you're quite right to air the concerns of your residents, so I'm quite happy to do that. So
let's have something in writing, Chair.
Yeah, I will take that to the committee as we draw the agenda to a close. Councillor Bernard Peters.
Thank you, Chair. Just a couple of points, if I may. If I could ask, notwithstanding the financial restraints that were shared with us initially and the sign-off by the NHS, why was this pitched north of the county initially? And come the day it is signed off, hopefully, will there be a timeline for it to come to Tamworth, Lichfield, Burton, south of the county? Because the services identified in the email are not unique to the north of the county. So I'd like some assurance on that point. And thirdly, just a beef on my part, in the table, the classic NHS generic term, diabetes, does that term mean type 1 or type 2?
Adam?
Yes, thanks. So if I take the diabetes question first, because that's an easy one to answer. So, and I will get that amended for any further updates. So that is the specialist diabetes service, and they support both type 1 and type 2 patients. And so in terms of the question about why the north and not the south, so this particular set of business cases came out of a public consultation, which was specifically for the north, hence the work being commissioned in the north of the county. But it's absolutely right to say, it would be unacceptable to have, assuming that we can move forward and find the capital eventually and develop these services, it would be unacceptable to have something in the north that we didn't have in the south. In terms of the development of a scheme for the south, I know that's something that Helen Slater of the ICB is commencing work on. So whether or not there's an opportunity to get some more detail for this committee, I can certainly ask her if she'd be willing to do that if you wanted that detail.
Yes, I'd appreciate that clarity, please. Thank you for that answer. Thanks.
Thank you, Adam. Any other councillors on this particular subject? Adam, thanks very much for your report. I think it goes without saying that it is disappointing that we're not seeing that development taking place. But hopefully you're in a position, as with the business case now set, that you are able to pick up and run with it, assuming a decision is reversed or made going forward. And thank you. And I think just to add, as a Lichfield member, Councillor Bernard Peters' request in terms of the south of the county, we would also welcome this kind of facilitation. So thank you very much. Oh, sorry, before I wrap up, Councillor Edger.
Thank you very much, Chairman. Yes, just to comment, you know, yeah, it's very difficult, Midland Partnership Foundation Trust, sometimes the positions that they're in. And being the partner governor, if there's anything, you know, in my position to take to the Midland Partnership, when I go to meetings or anything, please put them forward to me and I will take them forward. Thank you.
Thank you, Councillor Edgeley. I think that's a very valid offer there, so do thank you. So, in terms of then wrapping this item, I think first of all, I think whilst it's not directly associated to the agenda item, but I think we do need to draw that conclusion exactly where we are. So if committee are minded that I write to the ICB to clarify exactly where these proposals come from, if they are not proposals, why they are considered as proposals, and really get to draw it to a conclusion, because our residents, certainly in the moorlands, it's not, you know, we do need to think what they're thinking, and I get that, absolutely get that. So, committee, are we minded that I do that? Yeah, I'm getting
Thank
nods.
you very much, Mr. Chairman.
Thank you, Charlotte. And so, with regards then the rest of the report, obviously we would, if committee are minded, we will certainly ask the MPFT regards the south of the county going forward with that. So, a committee happy with that as well? So, if I've got it right, we've probably concluded then our business for agenda item 5. And so thank you very much for participations in that particular agenda item. And again, thank you, Adam. You may leave or you may wish to just stay on, but
thank you, Chair.
I'll leave that decision to you. Thank you, Adam. Item 6 is the Staffordshire All Ages Carers Strategy for 2024 to 2029. It's the action plan, and to the table we've been Cabinet Member Jeremy Pert and Andrew Jeps and Jan Cartman-Frost, and no doubt sitting at the back, Richard Harling if we need him. So would you, Councillor Pert, would you like to present the report?
Thank you, Chair. Just for committee's benefit, the all-age carers strategy was approved by this committee in March of this year, in March 2024, with a commitment to bring back the action plan once it had been developed. The action plan and the strategy covers multiple partners from within the County Council, for example, Children's Services, Adult Social Care, and many other front-facing parts of the County Council. It also includes people like the ICB, Midlands Partnership Foundation Trust, as well as the voluntary sector Together for Carers. There are a range of sections within the action plan which include the information, advice and guidance, identifying carers, physical and mental well-being, life outside of caring, assessment and support, short and long-term planning, and recognition and value. And they were the subject matters within the strategy itself. I can only apologise that having looked at your packs this morning, you'd have to do very well to be able to see the action plan, because it seems to have been cut off and covers across multiple pages. So I can only apologise for that, and maybe that's something that going forwards we could check before the agenda goes out. But it does mean members won't have seen the detail within the action plan, albeit members will have seen within the body of the report itself from paragraph 5 onwards some of the early successes that we've had. But in my view, that underplays some of the far-reaching actions that we've got, and actually many of the actions have already been completed within the action plan, which we can't really show you. We would be happy to do either or both of these things. If you wanted to see the action plan, we could put it up onto a screen for you. I don't know how the technology for doing that is, so don't ask me. So we'd be more than happy to talk you through that. Or alternatively, we could send that separately after this meeting for members to to review separately, and we'd be more than happy to take any further questions that the action plan may throw up outside of what you already have in front of you. Thank you.
Thank you. I suppose before we open up, are we content that we just get through it and the report can be sent afterwards? So I'm getting nods there, so we don't need the IT. So thanks for that kind offer. Members, Councillor Norman.
First of all, Chairman, if I can just publicly thank Jeremy Pert for guiding me to a working car park machine. Otherwise, I might have had a fine, as I did many, many years ago at my very first local government association meeting in Stafford, where I thought the car park direction was a bit ambiguous. I did get away with that one, but I might not go away with the second one, so I'm thanking him for that. Point out on paragraphs 11 and 12 are particularly good to see because of the respite that he'd given to young carers and carers generally, and also the pilot and the result of that and the result of that increased support there and so on, capacity. So they're really good. The only question I've got is really from my colleague who voluntarily left before the meeting started. Zach will hopefully confirm that, which was about ethnic minorities. There's no reference in this particular paper or the action plan to ethnic minorities, whether there's some targeting going on there or some sort. So I'm just passing that. I support the question, and I'm just passing it on. If there is some response, that'd be great. Thank you, Chair. Thank you very much.
Chair, if I could come back on that.
Please do, Jan.
Within the action plan, when you kind of get a chance to have a look at it in more detail, one of the elements we've put in there is we've successfully bid for some government grant, accelerated reform grant, and some of that funding will be used for an engagement and participation coordinator who will be based with our Staffordshire Together for Carers service, and that is particularly to target underrepresented groups, ethnic minorities being one of those, that was identified in the strategy and the engagement coming out of the strategy. There's been some delay in the accelerated reform grant funding, but that was just announced last week that is now coming through, and recruitment to that post will commence, and we hope that in Q4 they'll be in place, and that targeted engagement will be carrying on over the next, I think the funding's for 18 months for a post.
Thank you, Jan. Councillor Jill Hood.
Yes, I'd also like to thank Jeremy Pert for my first day 12 years ago at Stafford Borough Council. He showed me how to use the coffee machine. Seriously though, it's a question. I would just like to know how many additional care home beds have we booked, and how many in total do we have? Thank you, Chairman.
Jan.
Thank you. Apologies, I will come back to scrutiny, the committee on that one, rather than guess. So the particular point that I've included in there is work that the older persons team around block booking of additional beds in care homes. I know there is, when I submitted the report, there was quite a lot of capacity not taken up within that, so it's not oversubscribed, so there is plenty of capacity in that one. How we provide respite beds for people with other needs varies, so the block book beds were particularly around older people, but I'll come back on stats if that's acceptable on specific details.
Thank you, Jan. Are you happy with that, Jill? Yeah, thank you. Councillor Janice Silver.
Thank you, Chair. Again, another revealing set of information that we've got here, and particularly with the action plan, which I did manage to piece through, that was fine, but, we managed to get that. And what intrigued me in particular, because I think overall the recognition in just having this is bringing it a platform that is important. But what really intrigued me was the work with the relaunch in schools. And just to see how that was being worked, does it go across all key stages? So is it primary, secondary in particular, but also equally across the county as well? So we're getting a good representation across the county. I think it would be helpful for a bit of context on that, please.
Again, if Chair, if the committee would like a more detailed breakdown of the rollout to schools, so that's been carried out over the last few months and is across Staffordshire, and my understanding is across different key stages, primary and secondary. That is completed in January, and then the action plan sets out in the paper that work will then move on to primary care settings, so they prioritise schools around young carers first, and then they're extending that, which will the primary care settings will include young carers, parent carers and adult carers as well. But if the committee would like more detailed breakdown on schools, we could get that provided by Staffordshire Together for Carers.
Thank you, Jan. Councillor Pert.
Thank you, Chair. I just also wanted to add, in addition to what Jan has already said, that the County Council has been running its Dignity in Care Awards for the last 10 years, and it was a huge milestone. I'm sure all of us will go to various different awards celebrating excellence in various things, and the buzz in the room from those people who attended the 10th anniversary at the showground was immense, and I'd like to certainly put on record my thanks to everything that those people are doing, supporting our loved ones at the end of the day.
Chair, if I may come back, that's exactly what I had in mind when I was thinking about the recognition on there, and certainly the feedback from others who had been able to attend equally thought what a wonderful event it was and being able to do that. I think it would be helpful, Chair, if I may, just to get some further detail on the schools side of how it's been implemented. I can see that we've got that increase in 30% that's been reported, but I think that would be helpful to have that oversight. Thank you.
Thank you. Charlotte Atkins.
Thank you, Chair. I too want to come in on young carers. We talk here about a 50% increase in one-to-one sessions, but 50% extra on a very, very low base doesn't actually achieve very much. It achieves obviously something for the individual. What's your estimate of the number of young carers that you're actually getting to in terms of support? Because there's so much hidden caring going on, and what assessment have you made of the impact on those young people's educational attainment because of the extra responsibility they have for caring? So, these figures are great, but as we said earlier, the context is everything. If you're contacting 50 carers and another 50%, that's great. But actually, how many are you? What sort of proportion are you getting to, and what are you doing about ensuring that you get to more young carers? Because clearly we know that going through COVID and so on, a lot of young people have had a huge amount of issues around mental health, and that gets multiplied if they have a caring responsibility as well, and they're obviously worried about the vulnerability of an older sibling or younger sibling or a parent or a carer, and so that's more than escalated for a young carer.
Jan?
If I can try and answer Councillor Atkins' question. So the when we did the strategy earlier in the year, young carers assessments we were in contact with, it was representing around 25% of young carers in Staffordshire, and that was actually a much higher percentage than adult carers. And the action plan, I mean, the really big parts of that is around recognising more carers to kind of bridge that gap, and then enable them to get more support, and that's some of the actions that have been completed around that increase in capacity. So if I look at some of the data I've got in front of me, so young carers, so if I look from number of registered young carers, so in 2021-22 that was 204, in 2023 that was 289, and in 23-24 in up to the end of Q2, there was 506. So you can see some of the early actions. So quite a lot of the actions in the action plan have been completed because we talked about outcomes and what outcomes carers were seeking as part of the engagement we've done much earlier. And so some of those, all the leads kind of got on with a lot of those actions, and that's enabled quite a lot to be delivered, so increases in capacity for services. I think the other outcome, I think, from doing the strategy is, for me, is much closer working with children and family services. So it's highlighting collectively the impact, as you say, of young carers on other responsibilities. So in terms of monitoring delivery, children and families, there's additional governance in place for them to look at the impact on children's. We're doing briefing sessions to family hubs. Is planned for the new year. Briefing sessions have taken place with children, families, teams, again to raise awareness of young carers and the impact on those. And they are also undertaking the carers awareness training. So although the work isn't all completed, there's a whole range of actions in there to ensure that young carers are identified earlier and then supports in place for them. Specific statistics that you'd like around the kind of numbers, we could provide more full data on that from Children's Services.
The other issue I've picked up is that many young carers have to travel quite a long distance to get to this support, and that is a particular issue when they're caring, because it regards even more time away from whatever they're doing and puts an extra burden on the family. So that is the problem, and then you have to weigh up whether the support offered is sufficient for that time to be taken out of the day for that child or that young person to get that support.
So just on that one point, Councillor Atkins, so part of the offer for young carers is some funding for transport to access activities. So there's an increased range of activities. They do look at ensuring there are activities as locally as possible. If there are particular ones they want to access, then part of the funding arrangement does include transport. Should the family not be able to transport, which, as you've said, if they've already caring for somebody with additional needs, that obviously can impact on them. And the spend on transport to enable young carers to access has also been increasing, as you'd expect, as we raise awareness, assess more young carers, and they access more support.
Andrew, you wanted to come in?
Yes, it was just to add to your first question. How many young carers are there? And if we don't know in contact with them, of course, it's really hard to answer that question. But the best indication we have is through the 2021 census. That gives an indication, it won't be precise. And that identified a potential 1,610 young carers between the ages of 5 to 17. So you can see we still have some way to go, most probably, to identify everybody who is a young carer. And that's why all that work around engaging with schools and trying to identify young carers remains important. I think there has been progress, but we're by no means complacent. There is still further to go and really important to get the messages across.
Thank you for that additional information, Andrew. I've now got Councillor Kath Perry.
Thank you, Chairman. I'm all for this strategy, if I've said it right. It's very important, and I know under your care it will be a strategy that will be ongoing and working, because it's all very well having strategies so long as they don't sit on the shelf and become a volume of books, for the want of a better word, sorry. But I know under your care it'll be observed. I was going to ask, but I can see now that it's already down here. What framework have you put in place to make sure that the partners that we're using actually do what they say they're going to do? But I can see here you've got a range of metrics put in place for that purpose. So that's I've answered my own question on that, I think, by following it down. And you say on here, how often will they report? you've got annually, is that frequent enough to be annually? I'm just thinking, because you take more and more carers on board every day of the week, is what I'm saying. And things change weekly, daily, monthly, whatever you want to say or call it. So I just wondered if it wouldn't be possible to perhaps have a little bit more of sort of regular on that particular one, if that's okay. I'm just suggesting it. I met some of these carers a few years ago, actually, and it was very interesting to see and how they interact with each other on their downtime, let me put it that way, because it was a bit of downtime they were having. And I thought the communication between them, it was interesting to dig deep, a little bit deeper. Not as officers, as friends, basically, because sometimes they don't put forward how they feel or whatever it might be, because it's authority. And sometimes authority can stand in the way of people being themselves, if that makes sense. So I just wondered, you know, how often if you would sort of make it a bit more frequent. Thank you.
Anne,
If
you'd like
I
to come
can
in?
respond to that one, Chair. So the annual reporting is to the Health and Wellbeing Board via the Disability and Partnership Board, but the actual oversight of the delivery of the strategy is with the Carers Partnership Board. And one of the positive outcomes of the work we did engaging with carers across Staffordshire is we've recruited more carers with lived experience to join the Carers Partnership Board, and we've managed to secure a carer who's going to co-chair the Partnership Board, which for me is a really positive outcome from all the work we've done with the strategy. They meet quarterly. They approved the action plan in October, and I met with the Carers Partnership Board, and we agreed with them what information they wanted providing to them to determine that it was being delivered. So we will be developing a series of metrics, but they've also asked for some real life stories, each partnership board, about the difference it's made to carers, and we've committed to provide that. So it will be being monitored regularly by officers. We will have regular meetings we have with the ICB, Children and Families and Public Health around the delivery, a working group, and then we'll report in quarterly to the Carers Partnership Board, and they will report up into the annual report to the Health and Wellbeing Board. So it is being monitored more regularly and with the involvement of carers.
Councillor Pert.
Thank you, Chair. Just in terms of that first point, in terms of gathering dust, the intention is that the strategy covers a 4-year period, and it's the action plan that is the bit that is alive and vibrant underneath it, and breathes life into the strategy itself. And that's the bit that you have to piece together, unfortunately, but we will send round to you because it is comprehensive across a whole variety of areas. This area also cuts across a whole variety of strategies within the County Council, not only children's and families, but also adults and public health. And as a result, trying to identify and map where those linkages are and responsibilities outside of the Carers Partnership Board is really important as well, to make sure we're all holding each other to account, including those external partners.
Thank you, Councillor Pert. Are you content with the responses? Thank you. Councillor Phil Hewitt.
Thank you, Mr. Chair. And I have nothing at all to thank Jeremy Pert for. I just thought I'd mention that. Working with businesses to help, my question is extremely broad, Mr. Chairman. We will work with businesses to help build a carer-friendly community. So just give us some examples of where we work with businesses. So that must be a challenge for us. And I'm not quite sure whether we mean work with businesses to understand that carers have an issue who work for those businesses, or we work with businesses that report or work for the County Council. So I wasn't really sure about that. My question is pretty broad.
Thank you, Chair. Part of the work of the action plan, which still to be delivered is developing, widening the number of organisations that achieve the Carers Charter mark, which is quite comprehensive, and that will involve liaising with employers around support to carers, and again raising awareness of identifying carers, how you can support carers in the workplace, and what support's available to them. So again, apologies if there's sort of more detail around the businesses that have already been worked with. I can get that for the committee. But that's the intention within the action plan, that it's similar to the work we're planning to do with schools and primary care settings, which is around raising awareness, what support's available to carers, how people can support carers when they're identified, and what the offer across Staffordshire is.
Councillor Pert.
I was just going to bring my own anecdote. Thank you, Chair. I was just going to bring my own anecdote. I mean, during the COVID pandemic, we were desperate to try and get people back into the workforce to help support everyone effectively. And it's in some ways it was about trying to provide a sufficiently flexible approach and recognising where individuals started from. And life as a carer isn't easy because you've got multiple priorities all at the same stage. So recognising that and being flexible to the individual's needs actually in many cases sets organisations apart from others. And that is really important to get that recognition.
Councillor Hewitt.
Thank you. I did ask this question for a very particular reason, because I was a carer for a number of years and I worked for a huge multinational company and they were incredibly understanding of my needs and the person I cared for. And in reality, that made me a substantially better employee. Primarily because I fully understood their understanding and also the need to deliver what I had to deliver. So this is commendable that we're doing this. I just think it's quite a task, but that I think it would be easy to miss that off. It genuinely is commendable that we're doing it. In answer to the question, I like the answer. That was great. I think it's difficult, but yeah, I would really like to see some examples of where we've been successful on this particular point. I don't want to see a huge amount of examples. I understand that pulling data together would be quite challenging, but I'd still like to see some examples of it, because writing it down and then seeing the success of it is two different things. Thank you.
Thank you, Councillor Hewitt. Jan, and then Councillor Pert.
One. So what might be helpful as the committee? So the Carers Charter mark is quite high. So one of the things we're doing with the awareness raising and training is to enable more organisations to achieve that. But I think it would be helpful to share where that's already been achieved in Staffordshire, in case there aren't any particular businesses as good examples. And I suppose one example is the County Council. So as part of the engagement, one of the things we've done is actually reached out to carers who also work in the County Council, and they were met with as part of the engagement for the delivery of the action plan. So one of the follow-on actions which we've got to do is work with our people services to look at our offer as an employer as well of unpaid carers, and that's work that we've started as an example.
Thanks, Mr. Chairman.
I was just going to add, in addition to that, and my partner was a carer as well, and I absolutely associate with that flexibility, being able to manage those competing demands. Technology is also a great enabler for that, because actually I think employers' recognition that you don't have to be present to be working, I think is really helpful. But I think the suggestion to bring some case studies, to bring some of this alive to other employers and to pick up some of those pieces is a really good suggestion.
Thank you very much for the report. So, which I think I found very interesting for sure. I think the questions have been very proper and drawing from it. So obviously we accept the recommendations, and I think if we can just pick up those items that were mentioned on ethnic minorities and schools and case studies, if those can be brought, given us through a briefing paper, I think would be acceptable. Members, would you consider that as an appropriate response? Thank you very much. So if we can take those down as part of our acceptance on it, I assume I can move on to the next item agenda. Confirm, members? Yep. Thank you very much for that. And thank you, Jan and Andrew and Councillor Pert, for your contributions there. Thank you. Appreciate that. So moving on to agenda item 7 is the District and Borough Health Scrutiny activities. So if we can go to item 7. I'll get there in a moment. Do apologise about scrolling. Item 7. So we've got reports. If we just go to item 6 there on that agenda, if I can just go from the top then. Cannock Chase District Council, anything to be added to that? I know you've got a meeting due in a couple of weeks. No? Yes. You have, Fred?
Yes, we have. Yes, we have got a meeting on that in a couple of weeks. Excuse me, I'm not too well, so we have got a meeting in a couple of weeks' time. So yeah.
Thank you, Mr. Chairman, and never ever missing an opportunity to talk about the MIU unit at Cannock Chase, as often in the thing. Can I just commend Councillor Presswood, because he's very much brought it to the forefront and allowed me to speak on a very regular basis. And we are now inviting, I believe, the NHS into Cannock. So can I just commend Councillor Presswood, very new to the role. Had a chat with him and we've grasped this nettle together. That we're going definitely to keep driving this agenda. Also commend the officers in the County Council for great support from Zach on this as well. So I think it was worth mentioning that because I always mention it, and it's the law in my life. And also joining up with the same challenges that they're having in the north of the county. And we're going to keep going on this one, but I think it's worth commending Councillor Presswood for sort of joining me on this one. Thank you.
Thank you. I think it's always encouraging when new members have come on and running with something as good. And I wish you well, Fred. Well, we'll leave that to you. You've done exceptionally well so far, so thank you. East Staffordshire Borough Council, Bernard, you're the only one here, I think, from East Staffs. Bernard Peters, anything to report? No?
The meeting is, the last session concentrated on settings future, and that was going to be suicides and issues related to knife crime. But I'm disappointed there's no report from the chair. I'll give him a prompt, but apologies, Chair.
Thank you, Councillor Peters. Councillor Norman, Lichfield District Council.
As you probably know, Chair, we have a meeting tonight. Well, I'll be asking you questions. And what we shall be doing, finalising the health task group, which will be specifically on health matters. I know it is, obviously, well, not obviously, sorry, but my Overview and Scrutiny Committee, there's just one at Lichfield Districts that covers all sorts of subjects. And I do notice in some of the reports you get back, there's things that seem very hard to believe they're health-related, although you can say everything is health-related, from parks to finance and so on. But we will reporting back from the health task group on various issues relating specifically to healthcare and matters in the district, and maybe asking for some support occasionally, depending on the efficacy of the reports that we make. Thank you, Chair. See you later.
Indeed, you'll see me later in reverse roles. But obviously, as a Lichfield member, I do commend what Councillor Norman and his committee are now doing in terms of getting to an understanding of how we contribute to health matters that affect the district. So I do welcome that, and thank you very much. We've got nobody here from Newcastle, so we'll move on to South Staffs. Kath Perry.
Thank you, Chairman. As you can see, we had a meeting the 10th of September. I don't know why you haven't had any notes to say what happened there. Unfortunately, I couldn't attend that meeting, but normally I think Mark does send notes through to you. So I'll ask the question because we've got a meeting tomorrow night, so I should be there, so I shall ask the question. Okay? Thank you.
Thank you, Kath. I have to say, South Staffs are quite diligent on their reports. So I appreciate that there may be a very good reason, of course. Turning the page there, so Stafford Borough.
Yes, Chairman, yes, as you can see, we had, sorry, my voice is not very good, a report from Viola, which was very interesting, and they were commented, you know, what a really good job they're doing on collecting of waste and everything. And following from that, we've also organising a task and finish to look at food waste and how we operate with that, because that'll be something new, and that's coming in to fruition in 2026, I believe. It's got to be actions. So, and then we had Freedom Leisure, and we discussed a lot of things, a lot of questions put towards Freedom Leisure. But one of the things that concerned me was about the health impact regarding things for the elderly to do, you know. I mean, you have these fantastic gyms which are great when you're, you know, a young man or a young woman and that, but looking at the impact on health for the older generation and what they can do with armchair exercise and things like that. So that was brought forward. And also about the swimming situation regarding children from 1 to 5 and that. And again, the elderly, you know, looking at that. So that was all brought into fruition. But like has been said, we should have more of a report coming from the officers at the councils. So I take Mr. Norman's point, Councillor Norman's point, you know, we should bring that forward. Thank you.
Thanks, Councillor Edger. Staff Morlands, who wants to take the lead on this one? Councillor Jones.
Thank you, Chair. I'm sure Councillor Atkins might have something to say as well. I think we've already expanded quite a bit on bullet point 3, so I won't say any more about that. We also spoke about West Midlands Ambulance Service and their continually poor performance, and I'll speak about that. I'll mention that again when we get to work programme in a minute. Just worth noting, and I think you alluded to it earlier on, after about 18 months of pressure for me, we're now webcasting that meeting. So if you're tired of loose women on a Wednesday afternoon, tune in. It's usually quite entertaining. Thank you, Chair.
Thank you, Councillor Jones.
Just to add that our petition on the MIU is into many thousands already, and it's a fantastic way not only of obviously getting response from the community, but also explaining to people exactly what's happened. I mean, our problem at the moment is actually finding people who haven't signed, but we're working on it.
Thank you. And I have to say, it was because I was made aware of it, so I did go to the webcast and found the information that you were saying very good. And it was, you know, and obviously you'd expect me to obviously do that, I think, when was issues that are of importance as the one that you were addressing. There's no representative here from Tamworth, so obviously we can write to our boroughs and districts to get a bit more of a detailed report. it is very much the onus there for us to understand that they have that, we have a facility within our agenda to get updates. As long as I think what we have to do is keep the updates to health matters and care and anything that is associated on that, that's very good. So if we're happy then I'll move on to our next item, which as already alluded to by Councillor Jones, is the work programme. So I'm opening it up. Councillor Jones.
Yeah, well, thank you, Chair. Yeah, just given what we were saying earlier on about keeping Wallis Quarry in the crosshairs, I think maybe it'd be a good idea to have them on somewhere in Q1 next year. And also, we haven't seen the ambulance service since September, and the performance, whilst it's better, is still a long way from adequate. I wouldn't even say good, it's not even adequate, particularly in the moorlands. I'd like to see them back sometime in Q1 or certainly Q2 next year, not the autumn as is proposed. Thank you, Chair.
Thank you. We'll take note. We will discuss those, and certainly we'll try and fit in the Wallis Quarry as soon as we can there. And I think it's on terms of the West Midlands ambulance service. Let me go away and look at that, because I take again your comments there, whether we need to see that before the autumn probably is not a bad idea, so we will see how we can
I think it's worth doing, Chair. They are better, but still a long way from
I think it's again one of those ones that we just have to keep a monitoring and look at to get an update. Councillor Atkins.
In January, we're looking at primary care, dental and orthodontics. The last time we had dentistry on the agenda, it was not well presented, and we were getting a lot of fudging. And I do think that this time we really do have to ask them about dental deserts and what they're doing about it. They were trying to say last time, oh, they're only just taken over, etc., etc. But they had taken over, I think, by that stage for 1 year. And they were trying very hard, you know, to shift the responsibility. This time, I think they have to be, it has to be, they do have to give us some facts and figures about the take-up of dentistry. It's an absolutely vital public health issue. People forget, until they have real dental pain, how significant dental health is to overall health. And we can't allow the ICB to get away with overseeing a completely inadequate service.
Thank you, Councillor Atkins. I think it's a very valid point to raise there. So if you let me, I will, with Zach, we will try and get that more of a robust report that can give us a clear signal of where we are, whether improvements have been made or indeed not. So I think that's, again, very valid to raise. Councillor Bernard Peters.
I completely endorse the suggestion that we look into NHS dentistry, or dentistry full stop. But I'd like to see some information at that meeting that has been measuring performance and identifies backlog, particularly in age groups, because I understand that children's teeth are decaying at the rate of, well, quite a frightening rate because of the lack of access to NHS dentistry. So if you could weave that into the agenda, that would be really helpful, I think.
Again, Councillor Peters, I think we can give them a template to work to. I think that's what we're coming to here. Councillor Angela.
Councillor Peters' point about the dentistry and about children's teeth, this is where parents have got to come in as well, because they're giving these children lots of drinks with sugar in and that, which is ruining children's teeth. How we get that message out, I do not know, you know, but it is something we should consider taking action on.
Thank you. Well, I think there has been an attempt from the previous government regarding to fizzy drinks and so forth, and I think it's on the agenda of the new government as well to try and tackle these issues without being too draconian, because you know, we are in a liberal society and we want to do as things we wish, but I think it's a very valid point. So we'll digest those points, and we'll certainly write to the ICB regarding those dental issues, and certainly Wallis Quarry will come on to the programme again, and we'll just see where we can, if we can fit in West Midlands ambulance service to get an update. Even if it's through a briefing paper, that we can then, from the briefing paper, if we feel that we've not been answered the questions, then we can pull them in at a meeting. Would that be acceptable if that was done, Councillor Jones?
It'd be good to get the chief exec down, but I don't think that's going to happen.
Yes. Okay. So on that, I think we bring item 8 to a close. Before I read the exclusion of public, may I wish our dedicated watchers a Merry Christmas and a Happy New Year before we unfortunately have to close the meeting. So I move that the public be excluded from the meeting for the following items of business, which involve the likely disclosure of exempt information as defined in the paragraphs 1 of the Schedule 12A, Local Government Act 1972, as amended, indicated below.